Great. Thank you, Allison. And welcome, everyone. Thank you for spending your lunch with us. And I'm really excited to be able to talk to you about some things that we're doing, not just in Virginia, but nationally. So, Michaela, if you could flip to the next slide, that would be great. The title slide, the focus that we have for today's session is the Rehabilitation Act, Section 503. Next slide, please. I work for an organization, the acronym is SiSiBR. I fully admit it's not a fabulous marketing strategy, but it stands for the Council of State Administrators of Vocational Rehabilitation, and the organization is the membership organization of the 80 directors of the public VR agencies across the country. So we have programs in every state, the territories, and DC. In Virginia, we do have two programs. One serving the general population and one serving individuals who have blindness or a vision loss. It's a federal state funded program, so there are federal dollars and state dollars, and it's operated at the state level. We have roughly 25,000 staff nationally, and we serve 1.2 million individuals with disabilities per year. It's the largest single talent pool of individuals with disabilities in the country. And we serve them through our staff as well as about 10,000 community partners. The reason this is key is because the population we're serving ranges everywhere from individuals graduating or looking at careers coming out of high school, as well as those on the other end of the disability spectrum that are the aging workforce or people who acquire disabilities at any time. So today, what you're going to hear are some of the things that we're doing to support our business customers and to support individuals who experience a disability at any time in the employment life cycle. Next slide, please. I just want to touch a little bit upon the demographics of disability. In this country, disability is not a conversation that we've really had openly. Most of the time when we're working with business, what we hear is we just don't know what we don't know and we're afraid to ask. So I want to emphasize that the people in our program, we're not attorneys, we're not compliance officers. We really want to build relationships with our company partners and really look at solutions where we're building a talent pipeline and helping you keep that talent in the workplace. Disability is really part of a normal human experience. If you think about those in your immediate family, neighbors, people that you work with, you know, there are individuals that we all experience. So 1 out of 5 people in the U.S. Reports having a disability, but we know that families are all impacted by disability. And with many people, we're looking at individuals who may have maybe a child with a disability, but are also dealing with aging parents and some of the challenges of balancing work life and supporting family members. So as we age, and I know we're all in denial about aging, the potential for acquiring a disability increases. And if you stop and think about it, you know, we're looking at accidents, injuries, illnesses. You know, like I said, it can happen to any one of us at any time. And the interesting thing about disability is it is the largest diversity group in the country, and it's one that we can join at any time. So we're really focused on not just keeping people working, but also keeping people in their communities and returning them to their communities once they've experienced an accident, injury, or illness. And that includes veterans. So we do have a partnership with the Veterans Administration, Voc Rehab and Employment Services, and we serve anywhere between 10 and 12,000 joint cases. Our system also serves veterans who have acquired a disability after service, and we're working again to keep them in the workplace. So, you know, I think you can imagine with the aging population, one of our key focuses is really that retention piece. Next slide, please. So how does this all fit? Well, the Rehabilitation Act was established in the United States in 1920, and it started by focusing on veterans who were returning from conflict and injured workers, which at that point were agricultural. So the country started thinking about, okay, so someone acquires a disability, so do you house them and isolate them somewhere in an institution, or do we focus on bringing them back to the community? And I think if disability happened to you or occurred in your family, we all know that choice. We want to continue living our lives. So what they did was started to gather public input and how they would develop a program. There are 7 titles in the Rehabilitation Act, and they're really based on building a plan around a person. Our program, Vocational Rehabilitation, is funded under Title I, and that includes the programs that I talked about. We also have 89 partner programs on Native American reservations and Alaskan villages. So the program really focuses on a number of communities, but again, it's based on the premise that people with disabilities can work and live independently. And I do want to share with you, from the business perspective, we've looked at our return on investment, and for those individuals that were moving off of Social Security, for every dollar we invest in vocational rehab, there's a $7 return. And I think you'd all agree that we'd like to have our Social Security as we retire. So, putting people to work and really keeping that system vibrant is key. And, we chuckle a little bit, but this is one of the groups that really wants to go to work and pay taxes. And that's really why our program exists, is to get them back into the workforce. Next slide, please. So when we talk about Section 503, 503 is Title V of the Rehabilitation Act. And this title was put in place in 1973. So as federal legislation evolved, we see these changes occurring. And in Title V, it was really the first piece of civil rights legislation for individuals with disabilities, because a lot of the civil rights legislation did not include disability. So 503 was sitting in law, but really there was not a lot of things happening around this piece of legislation. So they started to look at how to really help companies kind of align with the vision, how to really start engaging systems to take a look at that, and really look at new language that reflected other disability laws. So in 1990, we had the ADA, we have a new definition of disability. So what happened was in March of 2014, the new regulations came out around Section 503. And again, really to align the legislation on other language and other pieces of legislation that were there. I do want to emphasize that the coverage is for federal contractors. Other sections of the law cover federal agencies and the requirement to have accessible services for individuals with disabilities. Other sections look at websites and the accessibility of websites and other pieces. So as you'll hear from our staff, and you'll hear as you're working with VR, we have assistive technology specialists on staff. We work with rehab engineers. So again, really looking at the law overall. But this particular section is focused on federal contractors, and there's 2 important pieces of distinct pieces here. And again, I'm not a compliance officer, so what I'm doing is talking to you about the law from the perspective of how we've worked with companies to make this work. So if you're a federal contractor and you have contracts or subcontracts of $10,000 or more, you're obligated for non-discrimination. If you're a contractor that has at least 50 employees and $50,000 in contract, then you have the responsibility for an affirmative action plan, which is the more proactive approach to really the outreach and recruitment and looking at how you recruit, hire, and retain individuals with disabilities. Next slide, please. So again, as I was saying earlier, why the change? Why the update? One of them was the change that we're seeing in other legislation, but there was also a look at the Bureau of Labor Statistics, which sits in the Department of Labor, and the realization that though we were seeing unemployment rates dropping for individuals without disabilities, the unemployment rate for people with disabilities remained pretty steady. So, workforce participation remained at about 31.6% for individuals with disabilities, while we saw individuals that didn't have disabilities participating at more than double that level. And again, the same in the unemployment rate. The unemployment rate for individuals with disabilities that wanted to work was close to double that of those without a disability. We also saw that the median household income for those individuals with disabilities remained at or below the poverty rate. And when you have a population like that, you know, it's really incumbent upon all of us to take a look at how we change, you know, start to make the changes, particularly when you've got a population that wants to work and you've got an increased demand for labor. We also realized that there are new tools and approaches to reduce those barriers and to keep people working, understanding that disability can happen at any time during that employment life cycle. And as I was saying earlier, we've got people on our teams that look at assistive technology. We have access to rehab engineers. We think about universal design and have worked with some company partners on how to really look at designing a universally accessible workplace, which from our experience has resulted in higher production for all workers. If you stop and think about some of the accommodations that you use every day that were actually developed for people with disabilities, I think you can start to see that the accommodations and that kind of universal thinking really is good for all of us. So, you know, how many of us use the electronic door opener even though we're not in a wheelchair? You know, we're pretty used to having that there. You see, you know, people using strollers, people making deliveries. You know, a lot of us use that every day. Many of us probably have in large print changed fonts, made things brighter on our computers, changed contracts. Again, initially things like that were developed for individuals with disabilities. If you think of the whole Good Grips product line, that was developed for individuals with arthritis. But there are a lot of individuals that buy that line frequently because it's just easier to use. So when we're thinking about universal design and access, that's kind of the bigger picture. Next slide, please. So let's start getting into the highlights of Section 503 of the Rehabilitation Act. So as I said, the ADA was first passed in 1990, and then we had amendments to the ADA. And in both of those, we had changes in disability and the definition of disability. And those changes focused on how that disability creates a barrier in the workplace and the effort to really look at how we reduce that barrier and keep people working or bring people into the workplace. And I want to emphasize the ADA does not require business to hire people because they have a disability. Disability is not a qualification. We're looking at how we employ the talent of individuals by maybe doing the job a little bit differently. So, you know, we've seen, again, a lot of accommodations in the workplace that make sense for that individual, but also impacted the company. We have a long-standing partnership with Walgreens, and in their distribution centers where they pick and pack merchandise for their stores, you know, we looked at the accessibility from a mobility perspective, but also understood that anyone that had a vision impairment, we had to think about auditory information, people who may have hearing loss, we had to think about how we made things visually. But I think the most impactful piece of the work with that company was the way that we took a look at setting up their ordering system, which was changing the screen that people look at the orders for stores on and making the contrast higher, making the fonts more readable. It looked like an old IBM Selectric typewriter print when we first, you know, went in and started looking at what they were doing, and then adding pictures. So as you can imagine, you know, where we've worked with Walgreens, particularly in Anderson, South Carolina, and their Connecticut site, their distribution center there. In Anderson, South Carolina, 40% of that workforce are individuals with disabilities, and it's the highest producing distribution center with the lowest error rate in the country. So those kinds of accommodations helped everyone have more accuracy, and also you can see where the pictures might be benefit to other individuals, particularly maybe those that speak English as a second language. So it allowed them to expand their thinking around, you know, what their workforce looked like. So with the utilization goals in Section 503, I do want to emphasize that these are goals. these are not, you know, a requirement. If a utilization goal is not met, what the OFCCP and the Office of Federal Contract Compliance Programs that sits in DOL is the federal agency that monitors compliance with 503. So if they see that a company is not meeting their utilization goal, what they ask is how you're going to change your plan of action. What are you going to do differently? So when they look at the 7% goal, they're looking at 7% across a company if you're a company of 100 or less employees. If you're a company of more than 100 employees, they look at the 7% goal by job category. So as you can imagine, when we're looking at companies like we're working with, like Boeing, where, you know, the 7% may be easier for them to get to if it is in a line worker position or welding or body work, where we struggle maybe on the engineering side a little bit more because we don't have the same level of availability of talent at that level. So, you know, I think, you know, everyone around the country is scrambling for engineers and IT specialists. So there's a lot of competition there and availability for people in that category. So they recognize that when they look at that 7% by job category. It also requires that companies have an invitation to current employees as well as applicants to self-identify if they have a disability. And it can be either done pre-employment or post-offer. So there is specific language, and at the end of the section, you'll see a website. There's specific language that's required, and they have those forms available, the self-identification form. We know that a lot of people, a lot of our company partners are struggling with this because there is a perceived, how do I say this? People don't self-identify easily because they're afraid that people are going to judge them. And that's one of the things we struggle with. So again, having the chance to work one-on-one with our businesses, helping businesses look past that label and start to look at what the person can do. The regulations also require that there's an equal opportunity clause in subcontractors and their outreach. So the federal contractor, of which there's over 250,000 in the country, also have an obligation to inform their subcontractors of their responsibility. One of the things that they look at is the quantitative measures, and I'm going to hit that in the next slide. But OFCCP also looks at data collection, where you're looking at the number who have applied, the number who have hired, and how you maintain your records for 3 years, and that they have access to those records, whether they're doing an on-site visit or they're looking at your records remotely, online and via other types of reporting. Next slide, please. I do also want to emphasize that there is another piece that lies in 503 that's adjacent to 503, and that's the VEVRA, the Vietnam Era Veterans Readjustment Assistance Act. So that includes veterans with disabilities. So if you're a federal contractor and you're hiring a veteran with a disability, you can look at counting that individual under 503 as part of your affirmative action outcomes as well as VEVRA. So here again, they're looking at a hiring benchmark that's established with the company, with the contractor, voluntary self-identification, and again, that same data collection and the equal employment opportunity clause to subcontractors as well as records access. So there's a lot of similarity here, and I like to include that so that those of you who are hiring veterans with disabilities understand that there are two pieces of regulations that really mirror each other. Next slide, please. So I want to get into a little bit of the affirmative action planning and reporting. So the OFCCP will be looking at your efforts for outreach and recruiting. So who are your sources? How proactive are you at reaching out to those sources? And again, I'm going to share some examples because I like to talk not just about the regulations or legislation, but what does it look like when it's working? Because I think we can learn from models that other companies are using. So documentation of your activities and looking annually at the assessment and effectiveness of those activities. So are you participating in job fairs where there are individuals with disabilities? Are you working with your VR agencies? Are you, working collaboratively with maybe community partners on efforts, much like you're engaged with the career pathway through this partnership? Those are all seen as very proactive outreach and recruiting. It's simple things like even looking at your website. Are you, posting that you're, inviting individuals, including individuals with disabilities, to apply and ask if they need assistance, where do they go? So again, marketing, how accessible is your website? How are you in terms of visibility in the community and the outreach? So thinking about how you document all those activities. And if that isn't effective for you, if you're not seeing a change, what's the next step? And sometimes that's sitting down with those partners and creating some type of a different strategy. When you're looking at the data, what they're doing is really looking at comparison data between the numbers of applicants who don't have a disability versus the numbers of applicants with disabilities, again, including veterans. So they're doing comparison data on non-disabled versus disabled, including veterans. The total number of jobs or job openings that you filled versus the total number of those positions that were filled with individuals with disabilities and or veterans with disabilities, or veterans if you're looking at VEVRA. So again, it's looking at your activities and outreach while also you're looking at the data and how much progress you're making. Again, required to retain those records for 3 years. Here on the PowerPoint, which will be available, is the link to OFCCP. And if you go on that website, you'll see fact sheets on the regulations. You'll see in-depth discussion on the definition of utilization goal, data collection, highlights of the regulations. You will see the posting of the required forms and the definitions for voluntary self-disclosure, all on that website. So I invite you to go there and take a look at those pieces. But remember that we're here as your partner. So I did want to talk a little bit about how we're working with a number of federal contractors and the different strategies that we have. Next slide. To do that, I just want to describe, when I talk about we, the National Employment Team, what do I mean? So you know that we're 80 agencies. Each one of our agencies has named a lead person to work with business. The reason we did this was early 2004, we sat down with a group of 35 business customers from around the country. And we said, it's great that we're planning careers for individuals, but it does not make sense to do that without the involvement of business. It's that whole concept of beginning with the end in mind. So we asked business, what do you need from us? In a dual customer model, understanding it's really our goal to connect talent to the employment need and support business in keeping people working, what do you need? One thing they told us was look at VR as one company. We've got 80 agencies. We're tough to find. Start to connect and work together. Make yourself an easily accessible network, which we now call the National Employment Team. We have a single point of contact for every agency where there's 2 programs in a state like Virginia. Those points of contact are working together. We want to take models that we develop in one state or one area and be able to move those across the footprint of a company. And we also have a vendor network of community partners. So you may have heard of Goodwill, or maybe a community agency. That's our vendor network. So we have the ability to hire those organizations, staff from those organizations to help us. If, for example, we need more one-on-one coaching in a job, or, whatever the need may be, if we need a sign language interpreter or things Braille. So we have access to those resources. But really our goal is building a plan with the business to take a look at how we can bring talent and services, and to do that as a national system. So we're really leveraging the strengths of our system to support our business customers. Next slide, please. I'm not going to go in depth here because you'll have the slide, but as we sat down with business, the other thing we recognized is that we have our own language in the field of vocational rehabilitation, and we asked them to help us think about that from their perspective and what that might look like. So any kind of pre-employment services, how are we working with companies on internships and business-based training? How are we working with HR? We don't always start with HR. Sometimes the call, comes in from a company because they're looking at how to make a workplace more accessible, or they want to do staff training. That's a frequent request from our companies. If we're going to be hiring individuals with disabilities, and we know that there's a lot of misperceptions and stereotypes around the term disability and the labels that are there, how do we help our team feel comfortable with it? Understanding that we're already working with people with disabilities in our workplace, but we don't necessarily identify them by the label. We identify them by whatever your coworker's name is, wherever that's diabetes or a heart condition or, a visual loss. There's just such a wide range. And so how do we help companies increase their comfort level, not only in hiring, but working in teams? Again, looking at compliance. And we're not compliance officers, but we want to be a value add to our company partners around building those plans out. We've worked with companies on helping them look at policy development or risk management, understanding that insurance rates don't go up when you hire individuals with disabilities. This is just part of, an overall coverage. We've also worked again with companies on developing products, testing products to make sure they're accessible, understanding that as the workforce ages, you've got a higher incidence of things like vision loss and hearing loss. So how do we start looking at that bigger picture? And then, of course, the strategic planning, which could include any of these types of services wrapped into a plan and delivered over a period of time. And that includes financial support and everything else that you see on this section. Next slide, please. Another thing that we knew is that we are working with a talent pool nationally. And when we work with an individual in vocational rehab, what we're doing is building a plan. So we've got individuals in college and university programs. We've got people in apprenticeships. We have people, like I said, in high school who are shifting and looking at their future. So not everyone is ready to go to work, but we do know that at any one point, we've got probably a quarter of the people we're working with have finished their career, their planning piece, and are ready to enter the workforce. So, 250 to 300,000 people are ready to go to work across the country. Well, one of the things we knew was that it was tough to know when you've got counselors who are working with these individuals, tough to know when someone is ready for the workplace. So the other thing that we learned from our businesses is how do we centralize that talent pool? So if I am the point person working with business in Virginia with either agency, how do I know who's in my talent pool, and how do I quickly get that talent to business? We knew that the platform had to be accessible, that the goal was to connect candidates to opportunities and connect businesses to potential candidates, and to have that direct connection. We also heard from our candidates that they'd be willing to relocate. So if someone wants to move from Maine to Virginia, how do they know which businesses are actively looking and really recruiting from this talent pool? On the other side, we heard from our businesses, particularly our federal contractors, that having a known talent pool of individuals with disabilities was key for them because it deals with that voluntary self-disclosure right up front. So I invite you to go look at tapability.org. It's our online portal. We have about 17,000 individuals actively looking for business or for opportunities right now. We're holding virtual hiring events. When you use the system, it provides reports on apply clicks and and sends individuals into your applicant tracking system, but you have an opportunity to know that those individuals are coming from a known talent pool. So at some later point, if you're interested, we can set up a demo. Next slide, please. I would be remiss, because I'm talking to individuals in Virginia, for leaving out the fact that in 8 locations, we have actual comprehensive training centers. So in Virginia, in Fishersville, there's the Woodrow Wilson Training Center. And Kate, who's on the line, can help if you want to find out more information there. But what's exciting about our partnership, and these are part of the overall VR program, is that we're able to really develop business-based training. So in these locations, right now in all of these locations, we're working with CVS, and you'll see they're a big partner of ours. So we're working on a retail training. We've got in several locations trainings for pharmacy tech, etc. So these are a piece of our program that we're really looking at in terms of how we develop our strategies with business and those business-based training models. Our goal in the future is how we take that training and make it virtual so we can deliver it across the country in a very accessible way. We're also very involved in a number of apprenticeships, internships, and on-the-job training or business-based employer-driven training programs. Through a partnership with Microsoft, we also have access to the Imagine Academy, and we are using that and have actually rolled it out in the Virginia site. So that's their online training for a number of Microsoft products, and it enables individuals to participate and then be certified. So our Virginia site is actually using the Imagine Academy to train people online as well as to support them in a classroom. Our next step there is looking at a couple of boot camp partners that train in coding and cybersecurity, and how we can work with them to make their training accessible to individuals through an online format. So again, building that future pipeline with our business customers. Now I want to offer you a few examples of company partnerships and what it looks like. So the next slide, please. Oh, well, before I get there, here's what a strategic plan looks like. Sorry about that. Looking at when we're building a plan, I want to get back to what I've said throughout the presentation. Who are the key players on your team? If you're a company that has HR, but you have compliance in one piece and maybe diversity inclusion in another, and you've got a training or a facilities piece, how are all those people coming together to look at how we work on developing a plan with your company? And how do we do that across the footprint of your company? Many of our company partners have multiple areas of operation. So on our side of the house, we want to make sure that across your footprint, we understand what you need and what the model is. So again, looking at the culture, taking a look at the work environment and the workplace so we understand if an accommodation is needed, what kind of an environment we're working in. If you've got a diversity inclusion initiative, is disability included? How can we assist there? And what are your goals, and how are you working with your subcontractors and the supply chain, who are also your subcontractors? We work with a national partner that has established a disability-owned business certification program, and we've been working and getting candidates there and making them available to our company partners as well. So really, it's a plan built around your goal and your footprint. Next slide. Now into the partnership. So Lowe's was an early partner with ours because we've been working with an individual who actually moved from, well, she had started in the Southern Bank, which was acquired by Wachovia, which was acquired by Wells Fargo. I think, you know, we all know what the financial industry's been through. So she moved from there to Lowe's, and when she moved there, she was really in the lead role of creating a plan for this company. Lowe's is a federal contractor, so when you think of FEMA and emergency management, they do a lot of the provision of material. We knew that they had a footprint. They wanted to start on their distribution side. We knew they had a footprint that included 14 distribution centers, so we started working there and looking at what would be needed. And again, How do you accommodate people in a distribution center, which for Lowe's is 1 million square feet? They also have smaller distribution centers where you can imagine where they offload things like lumber and large products that then are trucked to different sites. So again, it's looking at that company from the bigger picture. We started in distribution, but we quickly learned that there were people who may not be a fit in distribution, but were a great fit in retail. And as they started this initiative, they started looking at people that they were hiring at the corporate level as well. Obviously, because when you start to expand a diverse workforce, you want to reflect it at all levels in your company and bring in various skill sets. So I think what was interesting in year one of this partnership is that we identified that they'd hired 556 people from us across the country. We can provide aggregate data. We can't share names unless a person discloses, but they were shocked by that because people had gone through their regular hiring process. Once we know a company, we can get people into the application process that anyone would go through. And because the skill sets were a fit, they were hired. They were hired because they had the skill sets. And that's absolutely what we want to see with our business partners. In year two of that partnership, again, we focused on retail sites and expanding the training. And you'll see in our company partners that we've got training sites on the retail side across the country. We also looked at how to make their online application process more accessible and help them work there. The other thing was that they noticed they were hiring a number of people who needed sign language interpreters, individuals who had a level of hearing loss or deafness. So we worked with them to establish a national contract because they're such a big company. And so having a centralized contract made it easier for them to access the accommodation, but also allowed them to do some rate control. And again, we provided technical assistance and expertise and helped this company develop a disability awareness package that they use company-wide. I will tell you that Lowe's also hired some people off of our team. They're headquartered in North Carolina, and our director was not happy, but it's always good to have good people inside a company partnership. So again, it's taking our expertise to our business customers and recognizing that value. Next slide, please. I talked a little bit about our partnership with CVS. We have a national partnership with them, and as they grow as a company, and I don't know how many of you have been watching what's going on with CVS, but they've acquired Quorum, they've got the Minute Clinics, they've acquired all of the pharmacies in Target. They're currently negotiating the acquisition of Aetna. So this is a company that's growing, and they're in the healthcare industry, and they're actually the largest employer of pharmacy techs and nurse practitioners across the country. So in many ways, this is our largest healthcare provider. And with the acquisition of Aetna, you can see that growing even more. I met with their corporate team late last year to really talk about a strategy where we can look at company-wide. They have an employee resource group or a business resource group, a group of individuals within their company that focuses on their individuals with disabilities or those who are interested in this population, and they have those support groups within their companies, their employees already with CVS Health. So working with them to expand company-wide training on disabilities, we've worked with them on the accessibility of their stores. And if you'll notice when you go in some of their locations now, they have the ability to have vision screening and, an optometrist. They've got hearing screening, and they're really starting to expand on the Minute Clinic and the availability of retail, but also those healthcare services. So we're continuing to grow with them, really look at their local models. As I said, in the Virginia Training Center site, we've got retail training, distribution, which includes how to use a forklift and training people on forklift operations. But we're also looking at the pharmacy tech training program and have developed local models there where they're actually providing the training and apprenticeship and a certification for individuals that we're supporting. So again, a win-win with the company, but based on the need of the business. And in 2016, we had 250 hires here. We've already seen a large leap in that. We're looking at year-end data for 2017. And I think what's exciting is that in the DC area, we also had 75 high school students who met with CVS representatives to learn about future careers there and really learn more about the options in CVS. So, you know, again, that long-term vision of building the talent pipeline. Next slide, please. Hyatt is another partner, and Hyatt is also a federal contractor. We're looking at a need in the culinary arts area. So as you can imagine, particularly in their full service hotels, they need individuals who can do work in the kitchen, pastry, you know, any type of a chef or support to the chef, as well as room service delivery. They've got club level services that requires individuals. Anyway, banquet services, they support a lot of meetings. So there were a lot of opportunities. Now, there's a lot of people that go to culinary arts school and it costs a lot of money, but actually in the profession, what Hyatt helped us understand is that a lot of the people who are key chefs around the country have really grown in the ranks of a restaurant or a hotel. They don't necessarily come with those skill sets, but they develop them through the training. So what we did with the Hyatt was develop a 2-week hands-on training. Our partner here, our community partner, is out of the Florida area, but helps us with that training program around the country. So we've got 8 training programs in Florida, but we're also in DC, Maryland, Virginia, Colorado, Pennsylvania, Montana, Texas. We've got 3 sites in Washington, 5 in California. We're in Minnesota and currently developing a training in Arizona and Hawaii. So, you know, it's taking, again, that model that was developed with the company partner. VR brings the candidates. We pay the company while they're trained, and the company pays them. So they're actually employees of the company for that 2-week period. And we follow the guidelines. We have several people that have been hired by Hyatt, but we also have people who have returned to their communities where there may not be a Hyatt, but they're going into other businesses in the hospitality industry, including restaurants. We've had a couple of people go to work on cruise lines. We have one young man that came out of the Florida school system with a special ed certificate. So there's no way he could have participated in a culinary arts training program because he did not technically have a high school diploma. Through this program, he's now an executive chef for a Marriott of all things. But again, in this industry, we see people taking their skill sets and shifting across. And that young man with that special ed certificate is earning well over 6 figures and is actually setting up his own catering business, so going into business for himself. Again, thinking about the skill sets and the fit with the company and not being limited by looking at, you know, a special ed certificate. So building with business and really connecting that talent. Next slide, please. This is an interesting partnership, and for those of you who don't know, I am housed in the Seattle area. Excuse me, obviously having spring allergy. I am in the Seattle area and have actually worked with Microsoft since the early 90s when they started building disability into their overall diversity strategy. And I think the key thing about this company is that they look at diversity from both the employee perspective as well as the customer perspective. They are a federal contractor. One of their largest customers is the federal government. And in order to be a contractor in the software space, you have to think about accessible technology and how your software is accessible. So this company is invested in the talent as well as the accessibility and customer service side of the house. I have a title of a book up here that I would recommend if you haven't read, but the new book out called Hit Refresh by their CEO, Satya Nadella. He's a very interesting man, and he is really taking this company through a transformation. And if you've read the book, you'll know. If you haven't read the book, I'll tell you. oldest son, his eldest son, is an individual with cerebral palsy. So in this book, he talks about how his work with his own son and his what he calls about bringing empathy to his leadership in the company is changing and evolving this company. I will tell you, we're preparing ourselves from this, being in the backyard of Amazon and then having Microsoft as well as several other companies. They are planning on hiring 8,000 new people right here in their corporate headquarters. So one of the things we look at, we're always looking at accessibility and building the talent pipeline. This company recently hired their first chief accessibility officer, who happens to be an individual with a disability. So this is a big focus within their company. One of the areas they were very interested in is this whole autism spectrum or neurodiversity. Understanding that you've got a very talented group of people here, but they don't interview well. The big barrier here is the social barrier. So how do we start to look at building a way to bring this talent to the workplace and getting them through a process or changing the process where you can really see their skill set? So in the neurodiversity hiring initiative, what we do is help bring in candidates. It started with a pilot in Washington State. They're headquartered in Redmond. And so the first cohort of 4 or 5 candidates came from our state agency here. Again, we have a community partner called ProVail. And what we do is Microsoft screens and selects the candidates for this, and they bring them to a 1-week working interview on campus. So Microsoft pays to bring them and houses them while we pay for the on-site support, which is really, if you think about it, an on-site coach or mentor to the individuals. And again, it's mostly around the social aspect and how to help coworkers feel comfortable if people are not making eye contact with you, and how to help those individuals really start to connect with their coworkers. They experience a number of simulations, they work on projects, so they have a chance to really see the skill sets of these individuals over that week and to do it in a supported fashion. That company partner stays on site with Microsoft, not just through the week-long internship, but afterwards, because we've had multiple cohorts. They've had 40 hires out of this project, and these are lab engineers, design people, people who are product testing, looking at new solutions for the company, and we recently had 2 internships. And what I want to say is that these hires have come from Virginia, they've come from Ohio, California, Pennsylvania, New York. So these are candidates that we're bringing in from around the country to help meet the talent need of this company and really help build out that talent pipeline. So we've really worked with their leadership at a national and also local level. I think with the work that we're doing in Virginia with the training center, having individuals trained on the Imagine Academy will also help us start to identify candidates that might be a good fit for this project, as well as other initiatives that we're working on with this company. But they recognize the talent, they're benefiting from having those individuals working with them. And those individuals, one young man that we worked with was actually working in retail as a cashier and customer service, and as you can imagine, was struggling because social skills are not his area of comfort or expertise. But he does great in this environment and is now working as a lab engineer. So again, it's about that fit and understanding our company. And all of the companies I've talked with you about are federal contractors. I could go through a number more. Starbucks, the company that owns Redbox, Hershey, people that you don't think about. But we also work with Lockheed Martin. We've got new relationships where we're working with Facebook and Apple. All federal contractors, all looking at developing a plan that fits for those companies. So in conclusion, with my last slide, I want to say that we're a partner here. And if you could move to the last slide, please. We're a partner here. We want to build with our companies. We want to understand what your needs are so that we're building a plan that works for you and we're bringing the right talent. And again, emphasizing the fact that that retention piece is so important. And I'll end with an example about that. In Portland, Oregon, one of our company partners who actually came to our VR agency that supports individuals who are blind or have a vision loss is Intel. And they had one of their employees who was out hiking and fell. And when he fell, he hit his head and he lost his vision. So while we're working with this company, we're helping the individual as he's transitioning out of the medical facility back into his home with his family, looking at how to make his home accessible, transportation to work accessible, and then how do we work with the company to make the workplace accessible. And the company was very invested. I will just say Intel was a fabulous partner. This gentleman is an engineer. He owns 17 patents for the company and continues to develop and continues to be a contributor in this workplace. He also now is on the board of our agency and helping other individuals who experience vision loss and blindness later in life in their own adjustment. So this is really a win-win. We're here. We understand that you have compliance requirements, and it's our goal to help you meet those. But at the end of the day, it's far more about giving you the talent and keeping talent working and really making your workplace overall, with that overall universal design, so that you're making the most of the talent that you have employed. So I will end with that, and we can open for questions.
I have a question here that I will go ahead and read. Are there local contacts who are familiar with my local workforce for me to use to contact?
Yes, and on the last slide, there was a local contact in your area, so it's right in the PowerPoint. So Lauren Parker is the person that's our local person working with our VR agency. And Kate is on the line, I believe, with us, who can get you to individuals in other agencies around Virginia. We also have 2 points of contact for the National Employment Team. Dale Batten works with our general agency, and Cindy Roberts is a point of contact for our agency that serves those who are blind or have a vision loss. So I can send those to you as well.
Okay, that's the only question. If anyone else has anything, feel free to type in the question bar. But at this time, that's all that we have.
Great. So this is Allison again from NVTC. I want to thank Kathy for her presentation today. Extremely informative. As we said, we are recording this, and we'll have the archive up online, and we'll also be able to send out the PowerPoint to the participants. So you should have all that contact information on your follow-up. We mentioned Lauren. She's kind of serving as a, I'll use the word concierge, but any kind of questions that you have related to finding talent with disabilities and getting them into your workforce, Lauren can help connect you to the appropriate person at all the different agencies that are here to help you with that. And then I also want to direct you to this catalog of services that the Career Pathways for Individuals with Disabilities program has put together that sort of summarizes the different programs and services that are available to employers. So you can find down the link here, and it will also, you can also get that same information from reaching out to Lauren. And before we end, I just want to promote the next 2 webinars in this series. Next month on February 15th, also at noon, we'll have a webinar focused on office ergonomics, universal design, and assistive technology. And on March 15th, also at noon, we'll have a webinar on diversity at work and disability etiquette. So I encourage you to sign up for those. They're all free as well, or recommend them to your colleagues, either within your own company, the talent acquisition human resources team, or the facilities and operations teams, training, compliance folks, even legal departments, or your colleagues in other companies who you think might find this information valuable and will help them in their talent recruitment goals. So with that, if Michaela, you haven't gotten any other additional questions in, I think we'll end the webinar here and thank everyone for their participation.
Yep, that's it.
All right. Thank you so much for participating. And Kathy, thank you again for all of that wonderful content.
Thank you for the opportunity. I look forward to continuing working together.
Great. Thanks, everyone. Have a great rest of your day.